For joining us today for our nursing admissions information session. We're just going to go around really quick and introduce ourselves as representatives of the school. My name is Gracelyn Quessy. I'm the student recruitment specialist at IVCC. Laura, did you want to go next?
I'm Laura Hodgson. I am a coordinator of the nursing program.
I'm Missy Killian. I'm a counselor at IVCC.
Thank you. So just important for those of you who maybe this is your first time going through one of our info sessions, or you're just getting started with your admissions process. I know we're a bit of a mix of both those who are just getting started and those who have applied for this year or in the process of doing so. Make sure that you meet with an IVCC counselor to discuss your educational timeline and everything. You can make an appointment by calling counseling at 815-224-0360. Same with the Ottawa Center, or you can email with any questions. So the nursing programs at IVCC, we offer an associate's degree in nursing, that's the RN, also a certificate in licensed practical nursing, which is the LPN. Both programs are limited admissions programs, which means that though we are a community college and have an open admissions policy, these programs in particular, as well as a few other ones, have requirements and prerequisites that you have to have completed in order to apply to the program. And if you've not met the minimum requirements for the program, you're not guaranteed admission. Just an idea of what our classes look like for the fall of 2021, we admitted 80 students. So that is approximately 60 RNs and 20 LPNs. And with every year, everything's a little bit different, so it's subject to review. We're going to move on to how to apply. So the application timeline here, since we're kind of in the middle of two different cycles, I've added the fall 2022 requirements and like the dates forecasted for fall 2023 as well. So the application period, which includes when the letter of intent is available online, began November 10th, 2021, and ends in a few days, so February 10th, 2022. And for fall 2023, it kind of reflects the same way. It's November to February is when you file your letter of intent. The letter of intent itself is something that we'll go over in a little bit. The pre-nursing assessment, which is the HESI exam, will be taking place in April 2022. So for those who are applying for the fall semester, that's when you'll be taking that exam, which will be also calculated into your admission scoring. All documents will be due on May 19th, and notification of whether or not you were accepted into the program usually comes at the end of May. Shortly after Memorial Day, usually after final grades are posted. Registration for the classes will begin in June, and that's for this fall. And you can see the reflected dates for fall 2023. So the letter of intent, as we call it, it's actually not a letter that you have to draft or anything. It's more of a statement of intent to apply. And on that letter of intent, you'll want to check whether or not you're applying for the RN program or the LPN program. You can also select both. In fact, it's very highly recommended that even if you have a 1% chance of maybe wanting to go into the RN program, that you select both. Because in the end, if you are scored and everything and you've selected LPN and decide, oh, I actually wanted to go in the RN, you can't go back and change that. However, if you've selected both, you can kind of select the path that works best for you at the time. In fact, the prerequisites for both classes and the application is the same. The only difference being a few classes that are taken along down the line that aren't even included in the application process. Documents to be submitted. So these all have to be received by the Office of Admissions and Records prior to the posted deadline, which this year we said was May 19th. So we're going to need your proof of residency, official high school transcripts, or official GED and HSE scores. And if you've attended any other colleges in the past, we'd like to have your official college transcripts from those as well. And placement test completion and ACT, SAT scores if eligible for placement. Our counselor, Missy, will be able to go over that in a few slides. Also, we require the completion of a CNA course or enrollment in it this spring will be the last chance that you'll be able to take it before the fall admissions, fall semester starts. Or you've been working as a CNA and have fulfilled the minimum number of hours required to sustain your licensing and are still in the registry by the deadline, or the refresher course, which is the ALH 1215. So in comparison to the 8-week CNA course, the refresher course is more accelerated, kind of compressed into a 3-week format. Proof of residency. So this is important in that there are a lot of community colleges, a lot of colleges that have nursing programs, and we do give preference to the students who live within our district. If you have any questions about residency at all, there's a lot of kind of tedious details that you'll see listed here. But if you have any questions, please email our Director of Admissions, Tom Quigley. His email is there, and I'll also share that information with you via email after the presentation. Placement requirements. So Missy is more of the expert about this, so I'm going to throw it over to her.
Okay, expert, we'll use that term loosely, but glad you're all here today. Let's talk a little bit about requirements as far as placement testing goes. So we can look at SAT subscores for placement. We can look at if you've had coursework elsewhere. But in general, this is talking about like if you take placement tests. If you have any question on whether or not you need placement testing, please call the counseling center and we can let you know. In general, for the placement testing, you have to test into Math 1206, which is a tech math, or higher. It's basically you have to be past a pre-algebra level in order to get into the nursing program. You do not have to be at college level math to get in, but we do need to know that you're past a pre-algebra level. English, you have to be at college level English in order to get into the nursing program, as well as reading, college level reading. When you take a placement test, if you don't score there, then there may be developmental coursework that you would need to do to get there, or you can retest, or like I said, we can look at other measures as well. So any questions on that, let us know.
Okay, so up next is our CNA course. This program may differ from some other courses in that the CNA program is required prior to admission to the program. Our nursing faculty and Missy and I agree, and a lot of other people will tell you that this is a really great thing to have. It gives you a great kind of dive into what nursing will be like, and helps some people along the way decide whether or not it's the correct path for them. And so proof of current Illinois certification is required for this, and that must be completed by the spring semester prior to the first nursing course. So if there are individuals who are applying for the fall 2022 currently and have not yet completed the CNA course, you want to get a hold of us as soon as you can, so that we can hopefully get you enrolled in our second 8-week courses. And I believe there are still spots left from that, and those begin in March. So we're going to go look over kind of what that information will look like. The registry, this is where we'll be looking up your information. Once you've completed the CNA course, we're going to need to see that you completed your training. So here it says it was completed at IVCC, but it can have been completed anywhere as long as you get that information to us. And it shows that they had their competency evaluation, so the testing that is required after the CNA course, and that's been completed. If your CNA certification is older than 3 years, at the time that you are being evaluated, then you need to submit a proof of hours worked. So that's 1,020 hours during the last 3 years. That can be provided by via letter from your employer or pay stubs that say that you've been a CNA. And the 3 years, the clock kind of starts for fall 2022 from May 2019 or earlier. And for fall 2023, May 2020 or earlier. That would be, sorry, when the cutoffs for the CNA completion. Let's see. So if you, as we mentioned earlier, if you didn't work 1,020 hours, but you're still on the registry, you are required to take the Certified Nursing Assistant Refresher course. That's the ALH 1215 by the spring semester prior to your first nursing course. So by the end of the semester for fall 22 admission. And if you didn't work 1,020 hours in the last 3 years and you're not on the registry, then you're just going to need to retake ALH 1214. How applicants are scored. So we're going to go over the admissions criteria. So after you've submitted all your documents and you've completed your HESI exam and all your core courses, this is kind of how you're looked at in your candidacy for the program. So the students are going to be ranked and admitted based on the following, so that you receive completion points for your 5 core courses that you've completed, and we'll go over those in a little bit. For the grade points for those 5 core courses, and you will also get points for your weighted scores on the HESI test. So those scores are going to be totaled and ranked. If you want a kind of an estimate, you can go to that nursing calculator. So it's ivcc.edu/nursing calculator. It might not always be the most accurate representation. It gives you a good estimate, but if you have any questions, we'd be glad to help you, and you can email our director of admissions. So the core courses that you'll be completing prior to admission to the program are Bio 1007, which is Anatomy and Physiology, Bio 1008, Anatomy and Physiology 2, Bio 1009, which is Microbiology, ALH 1000, which is Introduction to Nutrition, and ALH 1002, Human Growth and Development. For completion points, students are going to be receiving 4 points for just completing each of the following classes. So the 5 core courses with a minimum of C. So that's what completion would be. A D does not count as completion for purposes of the nursing admissions calculation. Courses must have been completed within the last 7 years. And so that's spring 2016 or later for the fall 23 admission cycle, in 2015 or later for this upcoming fall 2022. If you've repeated the course, the highest grade is calculated into the scoring system. So for the completion points for those classes, 5 classes times 4 points, the maximum you get is 20 points for that portion. Up next is the grade points. So for each of those 5 core courses, you will get points for the grades that you received. So it's it comes here into this little formula. So the grade points are all divided by 2.5. As we mentioned, you need to have achieved a minimum grade of C or higher in order for these courses to be calculated in. As mentioned again, if you've repeated the course, the highest grade is calculated into the formula. And for that, the maximum would be 28.8 points for the grade points. And you can add that onto the 20 maximum for the course completion. So that's already 48.8 points. The pre-nursing assessment exam, the HESI, which you'll be taking, will be offered in April. And if you haven't already paid for that testing fee, it's $46. You can call into the cashiers and pay that over the phone or in person. It's a standardized test and based on a lot of different subjects. And I know Laura will be able to touch base on, we'll be able to touch on that a little bit later. The HESI test can only be taken once per year. And for your test on that, or your scoring on that, it's a maximum of 24 points you'll receive. So the total maximum points you can receive in terms of scoring is 72.8. The thresholds in terms of who is admitted changes every year. Basically, all students are ranked. They're giving their score. They're ranked from highest to lowest. The top 60 scorers will be admitted into the RN program, and the next 20 scorers will be admitted into the LPN program. After you're admitted, you have 2 weeks to confirm your acceptance. Actually, Laura, sorry, I skipped over you. This is actually your part, so you can talk about the HESI right now.
Well, again, my name is Laura. I am one of the coordinators of the nursing program, and I guess just really welcome, and I'm really happy that you're interested in IVCC nursing program. We take a lot of pride in our nursing program, and I always tell the students, you're more than just a number for us. You're a real person, and we really care about our students. And we're all here to help you and make you successful. So the first thing we're going to do is, once you pay for your A2 and you've done your letter of intent, I think maybe Walter indicated he's already has his letter of intent in. He's probably enrolled already in the prospective nursing Blackboard course. And in that Blackboard course, you're going to see some frequently asked questions. There's some questions, answers on what's in the A2, what's on the A2. And as you can see, it's grammar, vocabulary, anatomy, math, and reading comprehension. Each one of these exams are 20, 30, 40 questions, nothing overwhelming. In fact, we did a little study. I think to take all of the exams, it usually takes the student about 2 hours to 2 hours and 40 minutes. If you take longer than that, that's great. It doesn't matter, as whatever it takes to make you do well, and however your comfort level. I'm trying to think. This year, last year we tried to do it. This year we're going to do it because of COVID. We kind of got canceled, but you'll see in your prospective nursing Blackboard shell that I'm going to offer some math seminars. So the math seminars will be, there will be about 4 of them in the month of March. And it's going to be just on how to be successful on the math portion of your A2 exam. It seems like a lot of students have trouble with math, so we want to offer that, and one of our math instructors is going to do that. And again, after February 10th, after the letter of intent is closed, I'll be putting that on your Blackboard shell. I'm trying to think. And also on that Blackboard shell, you're going to see a self-help study guide. It's a very small book. It's probably got about 75 pages in it. It's not some huge encyclopedia that you're going to have to study. It's a very small self-paced workbook, and you can get it anywhere, whatever. Buy a used one. There's some at the IVCC bookstore, but you can buy a used one and study and do your best on the A2. Give yourself that edge. Okay, that's all.
Thanks, Laura, and thanks for letting me skip around. Sorry about that. So we're gonna, I was about to touch on the standby list. So as we had mentioned, basically when scores are tallied, the top 60 are accepted into the RN program. The next 20 will be in the LPN program. And if you're not in the top 80, you'll be added onto our standby list. There's typically not a lot of movement, but basically if an opening occurs, then students are offered admission to the program based on their standby number. So you just move up on the list if someone else has declined their offer admission. The standby lists don't carry over from year to year, which means that if you are not accepted for this year's program, then you're going to have to apply and complete the process again for fall 2023. So additional coursework, I know this is another slide that Missy can help us on.
Okay, so in addition to the nursing courses and the core courses, there are other general education classes that you will need to complete for the nursing program. Now, technically, you don't have to have them done before you get in. They're not part of the scoring system. You don't get points. However, it's really in your best interest if you can get them completed before you start the nursing program, because once you're in there, you're doing clinicals, you are working so hard to get the grades in those classes. The last thing you want to be doing is writing English essays or things like that. So when we work with students, we try to help them plug these in with their core courses before they start the nursing program. If you don't get them done before you start the nursing program, that's okay. You just have to have them with your nursing courses, and they have to be completed by the time you're done with your nursing classes, or else you can't sit for your NCLEX exam. Those courses for the RN, it's your English 1, English 2, psychology and sociology. And for LPN, it's just the English 1 and the psychology. You do have to have a C or better in all of these as well. Like she mentioned with the core classes, you have to have a C or better. In all your nursing classes, you have to have C or better. So you really want to make sure that you are working. There are also some other classes that are strongly recommended that if you can get them in and you have the time. Medical terminology is helpful, strategies for college. There's a dosage calculations class, and there's a Bio 1200. This is helpful before you do anatomy and physiology. It's a human body structure and function class. So if you don't have a background in anatomy and physiology, or you don't have a strong science background, that one is a good prerequisite before you would take your first anatomy and physiology course. And I think I already mentioned that last bullet point.
Thank you, Missy. So here is a sample nursing timeline. Everyone's is going to be a little bit different, and I know Missy can kind of walk us through this one as well.
Yeah, and I'm sorry, I kind of pop over this pretty quickly because I do stress with students that everybody's path is different. And that's why it's important to work with us in the counseling center. We work with you individually to say, okay, are you wanting to get in quickly? Here's what we need to cram in to get as many points as possible and get everything you need done by the deadline. Or do you have a family and a job and you want to go about this more slowly? Then we say, okay, here's your semester breakdown. So this is kind of what I do like you to see from this is, okay, once you get those core courses and gen eds and everything out of the way, then once you're in the RN program or LPN program is 1 year. There's no way to accelerate that. And did I say LPN? Yeah, LPN is 1 year, RN is 2 years. So we do have people sometimes say, can I double up on classes and get out faster? No, it's laid out the way it is, and that's how you have to do it. As far as those courses listed in year 1, yes, we can spread those out and do those more slowly, and it really depends when you're starting. It also depends where your placement tests put you, because if we do have to add in any developmental coursework, that's going to add on classes, which could potentially add to your time to getting into the program. One thing I do want to mention while this is up, the CNA class, if you do still have to take that CNA class, it's an 8 credit hour class, and it is run in an 8-week format. If you can take it in a summer, that's ideal. You don't have to, but if you can, because it's really tricky to schedule other coursework around it in like a fall or spring semester. It's 8 days a week. It's 8 weeks, and it's usually 4 days a week. It's either all day, or sometimes we have an afternoon evening class for the CNA. Sometimes we don't. Sometimes we do, it's like 3 to 9 p.m. So it's really tricky to schedule other coursework around it. So that's one of the things we strategize with you when you work with us in the counseling center, but something to consider is taking that in the summer.
Thank you, Missy, for that tip. That's a really great way to put it, and I have to keep that in mind too for future working with future nursing students. Let's see. Health requirements and immunizations. Laura, could you help us out with these bullet points and details?
Sure, but if I could piggyback on Missy, I would say I've been associated with the nursing program and worked in the nursing program for probably 25 years, maybe more. I know I don't look that old, but yeah, trust me, it's been a long time. And I can tell you that the counselors are excellent, even though I've tried to counsel students and I'm like, oh yeah, I didn't think of that. Oh yeah. So they're just really good at figuring out the best schedule for you. And so I would reiterate that. And also what she said about taking everything you can possibly take. I have students right now scrambling to find classes because they're missing an English or something else, and they want to graduate in May. And I want them to graduate in May. And we always do a degree audit. Like I said, the college is really good about helping you being successful. And sometimes you're so busy, you forget, oh, geez, I was told I need that class. So we do a degree audit with you. And that means if you're missing something, we'll tell you, but we're only going to tell you once because we know you're adults and you can figure it out. But sometimes you get busy and forget. So, okay, now on health requirements and immunizations. So after you're initially accepted into the nursing program, I'm going to meet with you in June, early June, probably the second week of June. And I'm going to go through these health requirements for at least 40 minutes. and I do that because there's a lot to talk about. There's a lot of questions because just as a student at IVCC, we're not really worried about your immunization history. But we're going to send you to some really awesome clinical sites, all the hospitals in the area, possibly home health, dialysis, pediatric units, you name it, we're going to try to send you to the best experiences. Those are the places that we have to make sure our students are well vaccinated and that we're protecting the patients and protecting you as well. So they are pretty significant. We have to go by our clinical partner. We have to go by their standards. So there's some things that are really time specific and they must be completed before you come in. So in the summer, prior to the entrance, that's the things that you're going to need to get done are the physical, the drug screen, background check, CPR, all that kind of thing. But I'm going to talk to you about that again in June when you get in. Give you the physical, talk to you quite a bit about this. So I wanted to let you know it is a urine drug screen, and I always tell the students, if you know, because Walter study is probably going to be coming in August. And I know this is a joke. I know some people might take a joke. I'm just going to tell you, if you're smoking marijuana or if you're doing gummies or doing whatever you're doing, you know, for your health, it will pick it up. It will pick up marijuana. And I've had students even do the gummies for sleep purposes. It will pick it up. So any prescription medication you're on is absolutely fine. The drug screen will pick it up. You'll get a phone call a day or two later. The medical doctor will speak to you. You'll get a fax from your pharmacy, whether it's Walgreens, CVS, or wherever you go, and you send that in and it's okay. So if you're taking something that's prescription, it's not a problem. But if you're not, we need to stop that because we will find it and we cannot send you to clinical for that with any kind of drugs. So background check, CPR, TB skin test, all that's going to be done. But some things that are not time specific, you need to go back and find your immunization record. Whoever raised you, mom, dad, aunt, uncle, grandma, grandpa, ask them if they have your baby shot records, your immunization records, because a lot of students don't. And then after they get all these injections again, then their mother produces their immunization. So go hunt for these because each and every one of these vaccinations can be very expensive. So be your best advocate, find every vaccination you can get. Sometimes a titer, and what I mean by titer is a blood draw. Sometimes that's more expensive to show that you're immune to certain things like measles, mumps, rubella, MMR, or sometimes the vaccination is cheaper. And again, I'm going to talk to you a lot in June about those, but if you can find any of your vaccination records, get a folder, start collecting them, and you'll be much better for it. Okay.
Thank you, Laura. So just following up more on the drug testing and background check, the background check required for this, even if you've received it already for the CNA class, this is a little bit more in depth and it is different. So this is something that there's a charge for. It's $52 for background check and $55 for the drug screening. Once again, this will have to be completed prior to beginning the program.
And that's after you're accepted though. And if you do have something in your background, you know, please don't say anything now. I don't want to know, but you certainly can call me if there's some kind of charge and you've done something in your past. That just don't let that stop you. We can work around it.
Thank you, Laura, for the clarification. For nursing program costs, this is a informational handout that I'll be sending out once again with the rest of the information and details from this presentation. Please keep in mind that there are foundation scholarships available. Foundation scholarships, those actually opened in December and are due on February 10th. So the same day that the letter of intent is due. There are specific nursing scholarships available, so keep that in mind. Similar for if you're looking to apply for fall 2023, there is going to be another cycle of scholarships that will open up this December 2022. If you have any other questions, please don't hesitate to reach out to any of our departments, nursing at ivcc.edu for nursing questions, counseling at ivcc.edu for counseling questions. And if you have any questions about the admissions or admissions process specifically, you can contact the director of admissions. His name is Tom Quigley, and his email address will be shared as well. Another way that you can reach out to us is by calling or texting our admissions line. That's 815-224-0439. We're not robots. We actually answer that texting service. It's probably going to be me, and we'll figure out the answer and relay it back to you. Does anyone have any questions they'd like to share right now?
Can I add one more thing?
Oh yeah, go ahead, Missy.
Okay, I'll say this real quick, and then whoever was going to say something can talk. I don't know if you mentioned this at the beginning, but we do have some late start classes this semester. Not a whole lot, but if you don't have classes yet and you're just starting and you're thinking, well, maybe I could start, you know, I could start now. Give us a call in the counseling center and we can see if there's something that we can get you in that would help you get one step closer to getting into the nursing program. Not today though, because we're closed.
Thank you, Missy. I'll make sure to add that on. That's a really good tip for those of us who are looking to move forward pretty fast on this. And I think someone was asking a question.
Yes, I had a question. I'm in the CNA. I'm enrolled for the second 8 weeks, which starts in March. And that's one of my last requirements I need. So that is going to give me enough time to be able to apply for the fall nursing program, correct? If I take it the second 8 weeks. Because you said something about hours, but I'm assuming those are going to be done during the clinicals in the program, or is there extra hours? I was just a little confused on that.
No, Walter, you're fine. Once the grades go in, they'll see that in admissions. That's perfectly fine.
Okay.
And you
I'm
don't,
an
it's,
athlete, by the way, also.
yeah, you don't have to have the 1,020 hours if you just graduated. It's if you haven't worked, you know, if it's been 3 years.
Okay.
So you're fine. You're fine.
Okay, and then one more question, if I could. So I have to take the physical, the drug panel, all that for the CNA course, obviously. So am I gonna have to redo that in June?
Oh, this is Anthony talking now?
Yeah, it's been me the whole time.
Oh, I'm sorry. I thought it was Walter.
No,
Excuse me. Excuse me. Your name is about this big on the screen. So yes, Anthony, that I'm really sorry about. I'm trying to think, like if you went to your regular doctor, like, you know, your general practitioner or whatever, and you take our physical in there and say, hey, you just did this physical for me. Can you fill out this form? Our physical is just a little bit different than CNA.
Okay.
So, yeah, you're gonna have to kind of do it
Okay,
over
that's
unless you
fine.
know. Well, and I really would like to, maybe, I don't know, talk to me, call me sometime and we'll, maybe we
Okay, I
can
can give
work
you a
something out.
call sometime next week or later this week and ask you
Yeah.
later. Okay,
Yeah,
thank you.
I'm gonna give you my phone number, so get something to write it down. My office number is, of course, 815
Okay.
224
Okay,
0525. And again, my name's Laura. And so if you're just, usually if I've taken physicals when you're doing it the second 8 weeks. So Walter, we might be able to help you, but if it's too long, yeah, we'll think about it. Give me a call.
okay, and does that apply for the drug test and all that other stuff that wasn't there, or are we just speaking specifically physical? You're just maybe
Yeah.
getting me out of the physical and then the other stuff I have to do?
Yeah, I have to do the
Okay.
drug testing. Yeah.
Okay, that's fine. I just wanted to know. Thank you.
I'm jumping in. Anthony, you said something that sounded like you haven't applied yet. Have you applied?
No, I have my letter of intent. I already paid for the exam. I'm pretty sure I have everything done that is needed. I
Okay,
also have
so,
the prospective nursing thing on my blackboard that she was.
okay, so you have applied. Okay.
Yeah,
It
yeah,
sounded like
everything.
you hadn't, and I was gonna say, no, apply. Okay.
No, yeah. I just wanted to know if we were gonna have to redo that stuff, the CNA stuff. Thank you.
I have a question.
Go ahead, Elena.
I'm actually already an LPN.
You know,
So-
and when I saw your name, Elena,
Yeah.
I'm like, what are you doing there? Like, are you kidding me? And you don't think I remember every student that's been through my class in my
I
nursing
saw the look.
program?
I saw the look on your face. You and I have spent quite a bit of time together. I'm just curious. I've been
Yes.
going through all of the entrance requirements, and I've been a nurse for 6 years.
Okay,
So I don't know how that works for
no,
me.
you don't need to be here. You just need to call me. We'll get you, I'm so glad you're here though, because the advanced placement students, which you are considered an advanced placement student, once you get your LPN, those letters are going to go out probably in about a month as soon as I get them drafted. So I'm so excited. So you want to come back and do your RN?
I do. I actually
Woo!
want to keep going for BSN too. So
That makes me happy. Yeah, why don't did you write down my number? I mean, you know where I'm at. You probably
Yeah,
have
I
my
did.
cell phone number.
I mean, probably.
Yeah, so yeah, just call me and we'll get that letter to you and we'll get you in August. And that's great. That's wonderful.
Okay, cool. Is it okay if I still stick around? Because it's been a really long time since I've talked to anybody at IVCC for the
Did you
meeting.
ask?
I said, is it okay if I still stick in the meeting just so I can hear what you guys have to say?
Oh,
Of
absolutely.
course.
All right, thank you. Oh, for the TB test though, that's within the last 12 months though, right? Because I have to do, like, I'm not caught up on my 2-step, but I was gonna do a 2-step in February. Would that be okay for the health requirements or?
But why are you going to do it? Because if you don't have to do it, just wait until, oh, you're probably working, you have to do it.
It's an insurance thing.
Oh, yeah, just go ahead and get it done.
Okay.
They want a 2-step within 12 months of you coming in. So you're
Okay,
good.
awesome, thank you.